Hey friends, I'm excited because we have a special guest, Anna Towne, with Strong Core Mama. Anna has been helping mamas get back to motherhood and movement. That's her passion. She is a doctor of sports medicine, physical therapy, and she spent 11 years in office working with clients. After becoming a mom herself, Anna saw firsthand how common it was for moms to silently accept discomfort, leakage, and weakness as their new normal. But she knew it didn't have to be that way. Motivated by the gaps she saw in pre- and postnatal care, Anna dove headfirst into women's health and pelvic floor specialty. Anna realized just how hard it was for moms to access in-person rehab, so she created Strong Core Mama. Maybe you've seen her on Instagram. It's a collection of virtual programs designed to make pelvic floor and core rehab affordable, accessible, and effective for all moms. Anna is a mama runner, triathlete who still loves to compete, often with a stroller in tow. I'm excited for you to meet Dr. Anna today. Let's get started. God, I just thank you for today. Thank you for Dr. Anna and just her passion and enthusiasm for living in the body that you've given us, and also using what we know about science and how you've created our bodies to bring healing. And I just thank you for her example to work hard and be steadfast and determined. And sometimes we just need to hear a story of people doing hard things, and that gives us hope that we too can do hard things and experience true healing. So as we talk today about just the body that you gave us as moms, God, I just pray for any moms or women listening that they would just be offered hope if they've been in a funk. We just pray for encouragement to take a next step forward and to believe in healing and rehab and physical therapy today. So just bless our conversation, and thank you for all that Dr. Anna is doing. In Jesus' name we pray. Amen.
Amen. Thank you.
Yay. Yes. Welcome, Dr. Anna. And I don't know, is it Towne or Towne? You might know her as the Strong Core Mama on Instagram and other places, because she's got, just a few people I think that follow her
It's
now.
fun. Yeah.
It's kind of blown out of the water.
Yeah,
The
since my
last
last
couple.
son, the social media thing has really grown a lot. I think it's that everyone wants to follow a mom that's in the same season as them.
Yes.
So it really grew a lot when
Yes.
I was pregnant with my third and then had my third son.
Okay. And God's been using that as a tool for your family and your business and everything. But before we kind of get into that, can you just tell us a little bit about who you are and who your family is?
Yeah, of course. I am married to my husband, Nate, and we've been married for, let's see, almost 9 years, and we have 3 kids. And you know what? I don't even know if it's 9 years. Yeah, 9 years. Okay, I can't even do math. When you're
Mom
getting close
math.
to 10, you're like, oh gosh. I always like think how old my kids are. So my kids are 6, 4, and 1. I have 2
Okay.
girls and a boy. And yes, I love being a mom. I always wanted to be a mom, and I'm just so grateful to be a mom. And then I've always been a physical therapist. I was a physical therapist before meeting my husband, before becoming a
Okay.
mom. I'm really passionate about the field of just helping all people, as of recently, moms specifically. But I got into the field because I had a serious back injury in high school and college, and I was like, I want to help people not live in debilitating back pain, because for me it was really challenging as a 16 and 18 and 20-year-old to have chronic back pain. And so I was able to rehab. My PTs had a huge impact on my life, and I was like, I want to do this with my life. So
Wow.
I became a PT, and I actually got to travel around the world and be a PT in Kenya, like before I met my husband, and had a grand adventure before having a
Yeah.
family.
That's awesome. And for those of you that might know her on Instagram, Strong Core Mama, like every other video is her running. So I'm kind of like shocked right now that you had a back injury, because that's giving hope to
Yeah,
somebody today that, maybe has been discouraged that our bodies can heal, obviously,
for
God
sure.
willing. So that's really encouraging. You're running, you're having
Yeah.
kids, you're doing all the
Yeah,
things.
the doctor told me, like, when I found out that I had like pretty severely herniated discs again in high school. They're like, you're gonna have a really hard time in pregnancies because you're gonna have such bad back pain and like it's gonna be hard for you to run and like all these things. And I've pretty much proven everything wrong. I'm like,
Wow.
sorry, I'm actually not okay with those. I'm not okay with my life looking like that. I want to move. I want to have babies and not have chronic pain. So,
Yeah. That's
yeah.
amazing. Can you share with us a little bit about how you became a physical therapist? And then I know you kind of started in the sports medicine
Hmm.
arena, and then the last several years, God's really moved you into postpartum, pregnancy, just
Yeah.
mom bodies.
Mom bodies, yes, for
Mom
sure.
bodies.
Yeah. So, yeah, again had a significant back injury in high school and college, and I was actually playing college tennis. So it was really hard because I was like on scholarship, but not able to play because of back pain. So the Lord really like
Mm,
used that a lot to like shape the trajectory of what career He wanted me to go into because I was
okay.
able to heal and get back to sport and activity. So I wasn't. I thought PT school was too much school. And so I was like, oh, it's so much school. You have to get such good grades. I was never like the smartest kid. I had to work so hard to do well in school. And so I
Mm,
was like, I don't think I'm gonna be able to do it. But then so I went into college with a different major. And then very quickly I was like, I want to be a PT and I will do whatever it takes to be a PT. So I worked my tail end off in PT school and also undergrad to get into PT school. But
wow.
it was so clear that the Lord like really had that calling for me.
Is that like
And
10
he
years?
yeah, so let's see, undergrad, 4, and then for me, and then PT school was 3 years of schooling, and then you do like your internships.
Okay.
So yeah, it's a doctorate level degree now, and
Mm,
then passing your boards and all so many hoops to jump through. But the Lord like saw me through it. It was hard. It was a lot of studying, but the Lord saw me through. But yeah, I loved my job. I never had any like dream of shifting from where I was. I loved working in the orthopedic clinic and helping people with back pain, neck, knee, shoulder, anything in the body really. And then I had my first kid or I was pregnant with my first and I had like debilitating pelvis pain, like front of the pelvis, pubic
mhm.
symphysis. I like have my little models here, front of the
Oh yeah.
pelvis.
Oh yeah.
And
Oh yeah.
so I like couldn't walk in pregnancy and it was so painful. I had a hard time being active and I kept trying to do research on like what am I supposed to be doing to like stay strong and healthy in pregnancy and like there was no good information out there. And so I was so
Wow.
frustrated because like as a PT, if I didn't know those things, like who did?
For sure.
Like there was no good answers. And so I just dove headfirst into everything, pelvic floor, prenatal, postpartum, and went on and got certified in specifically pelvic floor, specific prenatal, postpartum.
Okay.
And so that was, yeah, like almost 7 years ago. And I have been really learning and growing so much in that field ever since.
That's amazing. So that's good to know for people to hear that like PT is great, but specifically for what you're focused on, you weren't trained
Not at
in
all.
pelvic floor therapy, diastasis, like
No.
all the things. Okay. So really having a specialist help with that is important.
Yes, I
Okay.
have so many people who like email me for like a session with me because they're like, I saw a PT and it wasn't helpful. And again, that's not reflective of the PT. We all have
Yeah.
different specialties and niches, but it's very much something that we do not learn in PT school. I think we should, but I think a lot of times, especially since if you haven't also had it been impacted by that season of life, you don't realize how much it does change our body, how much
Yeah.
pregnancy and postpartum really alters everything.
For real. For real. And you're also technically now, I mean, do you consider yourself a stay-at-home mom and a doctor of PT? Like,
That is a hard, I mean, I am a stay-at-home mom, but I also do work 2 days a week, like pretty
okay.
consistently. I have to in order to keep things running.
Yeah.
And I also, for me, that's always been a sweet balance, a sweet spot is my kids are either in school or like my little guy, there's a really sweet homeschool high schooler who comes over and is a nanny for us 2 days a week. And so I have childcare 2 days a week just for the school hours. So 8 to 3. It's a short day. So I get as much done on these precious days as possible.
Yeah.
But then I love the freedom of the other days. The other days, we're outside, we're hiking, we're making sourdough, we're doing the
Mhm.
loads of laundry, we're just real life. And so I do like the balance of like, again, I love what I do for my work. It's so
Mhm.
meaningful for me, but I also really love my days with my kids.
That's really cool. And aren't we so spoiled to be in an age and time where it's not all or nothing, you
Yes,
know? I just
yes,
think like, man, especially even just dads, like my husband works from home and it's just such a gift, like
yes.
that our generation is really getting to back to family and saying, yes, you
Hmm.
can be at
Yes.
home and you can also do things because of this horrible but awesome thing called technology.
I know. It is such a blessing and curse. And I think running a business that has a lot of has a huge virtual component to it, I'm very aware of that. Like needing to
Yeah.
have boundaries on phone time and, technology time and set really clear boundaries is so important.
That's awesome. So you said like when you first became pregnant, and you were having pain, that's kind of when you felt that like calling or nudge to kind of enter this area because you specifically needed help.
Yeah. And then it kind of just kept growing. Like I ended up
Okay.
having an emergency C-section. I completely like prepared for natural childbirth, did all the things that you're like the stretches
Mm,
every night, all the things you're supposed to do, but ended up in emergency C-section. And so then I also like I had all these things that like left me in a situation of like what like I don't know, like why don't I know these things? Like why don't I know how to heal from a C-section? Like how do I work on my scar and how do I rebuild my core, my deep core muscles? And so
mm,
there were just all these questions and I didn't have the answer and that bothered me. And so
okay.
I started seeing more patients, again, moms in the pregnancy and postpartum. And then I noticed that like everyone felt the same way. Like no one had the answers and everyone wanted the answers. And so when I was pregnant with my second, I had such a better pregnancy experience. I had almost zero pain, which was huge shift from my first one, and I was able to stay
Wow.
way more active. And then I kept seeing the same thing with my patients. Like I had a lot of patients that were second and third time moms, and they're like, "Oh my goodness, my labor went so much smoother. I was like so
Mhm.
much like my postpartum journey was so much better." Like all
Yeah.
of their subsequent pregnancies and postpartums were more positive. So it wasn't just my experience. I was like, this stuff actually works. Like everyone across the board was just having, such more positive experiences. So it was very empowering. And I was like, man, this everyone needs to know this stuff.
That's so cool. So, okay, you were doing PT for an office,
Yeah,
and I'm assuming medical bills
yeah,
or, well, college bills from
yeah,
becoming,
yeah,
a doctor.
yeah.
How did you take that step to be like, I'm going to trust you, God, and I'm going to just do 2 days a week, or I'm going to just focus on this? Because I know a lot of times we
Yeah.
can be passionate about something or feel the Lord moving us, but we're scared to maybe leave something comfortable. Did you have to
Hmm.
deal with that at all in your business?
Yes, I've definitely had two hard shifts in my career, I guess. The first one was going from like the orthopedic sports med clinic where I was at for 9 years into a pelvic floor clinic. So that was a big shift for me, but I felt like
Okay.
the Lord was telling me like it was time to make a change. And then when I was at the pelvic floor clinic, I was also running this strong core mama business, and I again as a desire for me to be at home and be a good present mom, I couldn't be in the clinic and also be running my business as well as I wanted and needed to. And so I did have to step away from the pelvic floor PT clinic this fall in October.
Okay.
And that was really hard, but it like I feel like the Lord has given me so much like clarity every single step of the way of like this is what I'm calling you to do, even though it's hard, even though it's not necessarily what you want to do. But now that I'm fully just running Strong Core Mama and seeing the impact that it's having and able to really pour the time into my family and pour my time into this work, I like have so much peace that this is exactly where he wants me. So it feels really good. really funny because I always said I would never own my own business and I would never be pelvic floor PT. And I'm literally doing both of those things. So I
Oh, I
definitely
hear
think
you
God has
on
a sense
that.
of
I'm just
humor.
like,
Yeah.
yeah, I'm doing all the like, what? Why are we eating sourdough bread? Why are we
Yeah.
homeschooling? Yeah, don't tell God like, oh,
Yeah.
those people
Yeah.
are weird because you will
Yeah.
become those
Because
people.
you become what you think
Oh,
you will never do.
but that's
So
so
it's
cool because
fun.
I can hear you're passionate about it,
Oh,
and
yeah.
I follow you on social media and everything. And pretty much like if you have something in your life that people are annoyed with you talking about or that you can't shut up about, it's probably something you should be doing as a business
Yeah.
or for work because you can just,
Yes.
we all have these things that we're like, well, I could never do that. But you're already, I
Yeah.
can see you as an influencer in your friends and family or,
Yeah.
just being like, hey, do you need help with
Oh
this?
my
Or,
gosh. Yeah. I'm like always stuck. My husband always jokes I'm stuck at church talking about the pelvic floor after like every service. I'm just like,
after
I'm
every service.
sorry. But people just
Sorry.
have questions and I love to be
They
like a
do.
resource. So,
They do.
yep.
And you're helping so many moms. And I love how digital marketing or virtual programs, you can, actually just reach worldwide,
Yeah.
people for care. So that's incredible. So I'm excited that, God is continuing to
Yeah. It's
grow
so fun
this
to work with women all
business.
over the world. Really. I mean, there's women in Australia and Europe who have done the programs, and it's
Wow.
really fun.
That's so cool and exciting just to see. Can you talk about you kind of talked about how God's moved through this passion of yours and created a business. But what are some of the myths that you've helped mamas debunk?
Yeah.
Because I know that changes from generation to generation. Even just me, like we kind of chose and God blessed our option to have kids further apart. So just in
Mhm.
the time that I was pregnant with my first, information and
Oh, yeah.
everything changed in 12 years.
Oh,
And,
yeah.
I didn't even like wear a brace or wrap myself till after baby 3 because I didn't know about it. And I was like, why
Yeah.
aren't we learning from these Chinese women that look amazing and don't have
Yeah.
all the issues we have? But what
Yep.
are some of the, myths that you've discovered that a lot of us as like American women might believe when it comes to pregnancy, postpartum, even sex after
Yeah.
pregnancy?
So
Yeah.
many things. Um, these are things I'm like constantly messaged about, so they're like
Okay.
so easy. And there's like a lot of them, but I'd say specific to pregnancy, a lot of us just accept that like pregnancy is just going to hurt and it's going to be really painful. But really, there's so many things you can do for pain prevention in pregnancy. And again, I've experienced that personally, but also I've seen that across the board with treating patients that are pregnant. Like there's so many things you can do. Some of it is like brace support, some of it is exercise related, but there's so many things you can do in pregnancy to have less pain. So that's a huge one.
Okay.
And then the other thing is in pregnancy is like you can and should stay active and strong in pregnancy. We actually need to be stronger in pregnancy than we were
Mhm.
pre-pregnancy because we have so many hormonal changes and we have so many weight changes and posture changes. We need to be strong. But a lot of moms don't know what to do, right? So that's a huge thing for me with a pregnancy program is like teaching moms how to strengthen properly.
Okay.
And so they can feel empowered in their pregnancy and not like, oh, well, I can't do that. I can't do that. That's off limits. It's just like there's so many like,
Yeah.
can't do this. And that just is not a fun way to live, especially if it's someone
Yeah.
that who likes to be active and it's important for like their mental health. And then they
Mhm.
like, I can't be active. That's very like limiting.
Yeah.
Um, so yeah, a lot in pregnancy, postpartum. The main things I hear in postpartum is like, well, this is just my new normal. So whether that be back pain that they have every day, lifting their kiddo up, or whether that be leaking with sneezing and coughing, um, a lot of again, this is like, well,
They're
I'm
common,
yeah,
but not normal.
they don't have to be
Yeah.
normal, but moms will
Yeah.
say this is my new normal. Like I just have to
Okay.
live this way. But it's like,
Oh yeah.
no, you don't.
Yeah.
You don't have to live
Oh.
that way. And so then a lot of women too, like they feel like they can't get back to the activities they enjoy because of pain or pelvic floor symptoms. So a lot of women, maybe enjoy weightlifting or want to be able to run a 5K, but they feel like they can't do those things because they just never got back to it post kids.
Wow, yeah.
But I just think it's important for us to have like be able to do the activities we love. Again, whether and that's different for all of us, whether that be hiking with your kiddo in the ergo, or that's playing soccer in the backyard, right? Like I think
Yeah.
that's important for us as moms. I'm a mom that loves to play with my kids, and so if there's something I can't do with them, that makes me really sad.
Yeah.
And then you mentioned one like postpartum and perimenopause. It's really common for women to have pain with sex. And so, as pelvic floor PTs, that's something that we talk about a lot because there's a lot of things you can do to decrease pain with sex, and that's a huge part of marriage, right? And so, I actually
Yeah.
really like working with these women because it's such a game changer for them when they are able to have pain-free sex again, and they're so grateful, and it's such a game changer. So that
Wow.
one's huge. Um, and then I guess two other ones: C-section. C-section moms, I think, and again, I have had C-section, so I really feel for those moms because they really, unfortunately, by our society, are told that their birth was less than, and that there's a lot of shame involved in that. And so, I created a
Mm.
C-section program specifically for moms that have had belly births because there is just a lot of like fear and shame involved. And so, really helping those moms realize like there's actually a still rehab process needed. You can get back to full strength and you can heal your body. Your body is not bad. You did nothing wrong. So, just have a really special spot in my heart for those moms because there is a big mental component to it. Again, in our day and age where
Yeah.
um, yeah, I'm so for, VBACs and all of those things. I actually really work with a lot of patients with that, but that's not every mom's story. And I think it's important to not shame those moms.
Okay. That's awesome.
And the last one is it's never too late to make changes. So I have so many moms who are doing the program after their kiddos, and then they're like, "Hey, my mom complains about these symptoms all the time. Like, can my mom do this program?" I'm like, "Yes." So I actually have a lot of moms and grandmas doing the
Okay.
program together, which is so fun. But you're
Yay.
never too far out to make these changes in your body, in your core, in your pelvic floor.
That's super cool to know because I
Yeah,
know, um, yeah, just even with family or friends that have been older, like, can still remember when I was a teen, jumping on the trampoline with my mom or her friends, and we would start giggling because 'cause they're like, "I have to pee right I'm gonna pee my
yeah,
pants,"
yeah,
just these things
yeah,
that after you push 3 babies out,
yeah.
you know,
Yep,
things are a little weaker
for
down
sure.
there, and we
Yeah,
do accept things as normal, but,
yep,
just like our walk with the Lord, like, it is never too late to
yep.
come and experience healing or forgiveness through the cross, but also just with our bodies, there's hope. So you're saying even like grandmas have had,
Yeah,
you
for
know,
sure.
success in healing that you've seen?
Yes, often.
Wow.
I've worked with women of all generations, all ages, and it's really pretty amazing and profound. I mean, there's really research that shows that even in your 90s, you can make changes in your muscles
Wow.
because you can always rebuild. You can
Hmm.
always make brain muscle connection, and so it's all
Okay.
about rebuilding that brain muscle
Yeah.
work.
That's amazing. I love that. So, can you take us, maybe toward the spiritual side a little bit and connect the dots for how just, as a believer, how is our physical health really connected to our spiritual health as Christians, and how do you live out that connection,
Yeah,
with your passions of running and doing what you're doing? How do you connect those dots?
for sure. Well, I think everything needs to be in its proper place, right? So I do definitely think that our physical health is connected to our spiritual health. I think that if we try and separate them, that's just not how God created us, right? We have a
Hmm.
body and we have a spirit. But I don't think that our physical training should ever be more important than our godly training. So I do
Sure.
think that, I mean, in our, again, day and age, it is easy, especially in Colorado, where people, kind of worship outdoor activities
Hmm.
and adventure and physical
Mm.
challenges. I think it is easy to get those messed up.
Sure.
But I think, again, I come back to just how that physical health is connected to your spiritual health. And we're really called to be good stewards of what the Lord has given us. We're called to, to like pay attention to how we're fueling our body and how we're
Yes.
moving our body. Um, And so I like the scriptures that come to mind for me is like Romans 12:1. Therefore, I urge you, brothers and sisters, in view of God's mercy, to offer your bodies as a living sacrifice, holy and pleasing to
Mm,
God. This is your true and proper worship.
mm,
And then the other one, 1 Corinthians 6:19. Do you not know that your bodies are temples of the Holy Spirit who is in you, whom you have received from God? You are not your own, you were bought at a price. Therefore, honor God with your bodies. So I just think that's so amazing. Like we are yeah, we are a living sacrifice. We are temples of the Holy Spirit. And so
mm.
how we treat our bodies really does matter. And so that's been really helpful for me. Sometimes it's like, okay, does this stuff matter? And I really do believe this work does matter. God cares about our physical bodies.
That's so good too, because sometimes we can say, like, well, this person's doing this because they're obsessed with the flesh, or, but,
Yeah.
like what you're saying, like your heart's on fire for, like, no, this is the body God's given me and I want to steward it well. And
Hmm.
you're enjoying the things, you know, God's created you passionately to do, bring hope
Yes.
and healing in this arena and run and chase and do all these things. But I love how you connect those two, because a lot of times we do just focus on one or the other. And I think that's the challenge of motherhood too, is
Yeah.
spinning all these plates. And there's usually one that's kind of like, falling
Yes.
off, if we're
Yes.
working, parenting, marriage, our own body, self care, not in a sinful, worldly way, but just stewarding,
Yep.
stewardship of what God has given us to do,
Yep.
is so good, that you bring that up.
Yeah. And I just think it's so important. I think sometimes as moms, we do really just kind of accept like, well, this is how this area is going to be. Like I might not ever accept healing in this area, but I think so many women just end up feeling broken. Our God is a God that heals. Again, whether that be physical or emotional,
Mm,
spiritual, like our God is a God that heals, and so He cares about our healing. He doesn't want us to be suffering from debilitating back pain or from pelvic floor dysfunction. Like our God wants healing for us. And so
yeah,
I've just seen Him heal so many women. And so it's really powerful to see that. And it makes me want that for all moms to know that
for all
like
moms, yeah.
healing is possible. And I think of this story, the woman who bled for 12 years.
Hmm.
I mean, that's very much like, a female problem, right? And there's
Yeah,
so many stories of healing, but that one for me is really impactful. But the Lord healed her. It's just beautiful. Like the Lord is able to heal everything.
yeah,
So yeah, I think it's very intertwined. And I am thankful to get to work alongside women to help provide the healing. But again, I do think keeping it in the right place is so important. And as moms, we don't have a lot of time, and I'm
hmm.
very aware of that.
Have you gotten to see, like, just what you might consider a miracle of someone who has been completely depleted, hopeless,
Hmm.
come in and experience, a kind of a new life, um,
Yeah.
through this process?
Yeah, it's so hard to choose one because I get weekly messages from moms of
Wow.
their wins. I call them wins. We celebrate the wins, right? And so I can think of, so many women who have said, this really honestly changed my life. A lot of them, again, have been struggling with like pain with sex, and that really impacted their marriage and also really impacted their mental health as well. And so once they
Mm,
were able to have pain-free sex, they really felt their marriages benefited, and they also felt better, and had
yeah,
less like shame or frustration and anger, anxiety, all of those things that can be connected. And then so many women who, again, really felt like they were just had to accept like man, back pain is such a common one, such a common thing that I think as moms we're like, well, it's just part of getting older, it's just part of being a mom. But so many women are like, oh, I didn't even know that I could have this little amount of pain, or that I could gets back to this activity. A lot of times with pelvic floor symptoms too. It's funny
Okay.
how many times a client or patient will tell me, like, my husband is so thankful that we don't have to stop as much on road trips because I don't have to go to the bathroom all the time.
Hmm.
And, all of these, what seems like a small thing, but it's really a quality of life issue. Like if you're having to go to the bathroom every hour, that really affects every single day of your life, right? And
Sure.
so there's just a lot of pelvic floor things that we just accept as normal, but they don't have to be. So a lot of women tell me, they're like, man, I just wish I would have done this sooner, because
Hmm.
they don't do it like right after kids. They wait decades, which they still get benefit from, but they're like, I just didn't know about this earlier, and they wish they
Yeah.
would have.
Yeah, people really weren't talking about this, I would say, until my last two pregnancies. So, like,
Exactly.
the last 5, 6 years is like, and then it became like, "Oh, yeah, I'm gonna go see a pelvic floor specialist," or, like, we didn't really talk about it or,
Yep.
care about it. What would you say to that person that is listening today that's like, "Okay, I wanna take a step forward into some form of healing." Where do
Yeah.
they go from there? How do they connect with you? What does that look like?
Yeah. Yeah, I would encourage women of any age to pursue some type of pelvic floor PT, and I do think it's important to find a good fit. I again work with a lot of women who have maybe tried other PTs, or tried
Mhm.
even other pelvic floor PTs, and maybe not find someone that they like align with. And so I think it is really important that you feel safe with your provider and that you trust them, and that you feel like you can really work towards your goals together. So
Okay.
if you have a negative experience, I would say, make sure you do your research, make sure you find someone that you feel comfortable and safe with. And then I absolutely, like you said, you can see that I'm passionate. I love working with women. Right now,
Good.
do a lot of virtual sessions, which is so fun because I get to work with women all over the country and world. And then I have virtual programs for moms, which is really fun because what I realize is it's so hard for moms to get into the PT clinic. And so after hearing that over and over and over again, I was like, why? Actually, 2020, everything happened 2020. I made the programs virtual because, everything was virtual. And then I realized quickly all the moms were like, this is awesome. I can log in, do a 15-minute rehab class, and then I can fit it in around my kids' naps. I don't have to find a babysitter. Like
Mhm.
there's so many roadblocks to us getting the care we need. I mean, I have find it so hard to get in for an
Mhm.
appointment. Like even for my, annual physical, like it's so hard because I'm not going to take my 1 year old, but like what else am I going to do? I'm not going to pay for a
Mhm.
babysitter. And so I just realized how well it worked for these virtual rehab programs. So I have 5 of them now,
That's
and
amazing.
it's really easy to log in. They're all 15 minutes,
Okay.
no longer than 20-minute classes. And so it's honestly, it's the way I fit in my exercises too. I'm always with one or three of my children climbing on me or around me, and then I just follow along the videos. You start it, I tell you exactly what to do, what to feel, what to not feel. So I'm giving really the same cues that I give in the clinic. They're the same
Okay.
exercises I give in the clinic, and they're the same cueing that I use in the clinic. And because I've done it with so many hundreds of patients, I feel really confident that like those are the exercises that you need for
Yeah,
core and pelvic floor.
because there's so much, like, if you just even Google,
Oh my
like,
gosh,
if you
yes.
Google thing, there's so much, and it's like, "Well, is this the right one for me?" Or, "I'm having back pain with this one," or, you know, different things going on, whatever.
Yes, it's
So that's
very
good. And
overwhelming.
how many, lessons are in, like, one of your virtual programs?
Yeah, so it varies for all of them, but so for the pregnancy program is going to be at least 8 weeks. And so you can start at any time in pregnancy, but there's some labor prep classes as well. So those really help moms who
Okay.
are trying to prepare for a vaginal delivery or a VBAC. Then the postpartum, there's actually an early postpartum program for like the first month or two, because a lot of times we feel really stiff and sore, but we don't know what to do because it is
Mhm.
important to not overdo it. but there are some
Yeah.
gentle breathing exercises. So that's only a month program, but then the other programs, around 12 weeks is the average of it. There's the C-section one, the core and diastasis one, and
And when you
then
say
there's,
12 weeks, that's
yeah,
like I do this one video for this week, or is it like two
yeah.
videos a week or yeah.
So the goal is to do a class at least 2 to 3 times. So that's, you're
Okay.
doing, 15-minute classes again, at least twice a week. And then some
Okay.
women want to do more than that. That's awesome. I would recommend not doing it like every day of the week, but no one really does that. But at least 2 days
Okay.
a week is really the goal. And then each week gets harder. So each week you'll progress exercises and build on like the
Okay.
previous week's concepts. And then I have a lot of educational lessons because I'm a big believer that exercises alone isn't really what cures us. We really have to understand what our body's doing. So I have lessons on, pelvic floor prolapse, and then I have lessons on diastasis recti, and all these things that no one teaches us, I have lessons on. And so you can kind of log
Okay.
in and listen to those lessons at any time.
That's awesome. And we'll include all these in the show notes because I know you have a ton of free resources as well because
Yeah.
you've been doing this for a while. So
Yes,
that's
I'm asked
awesome.
so many questions, and so I love making I have a lot of vlogs on pretty much all
Hmm.
the myths that we talked about earlier. I really
Okay.
have blogs on all those, and then yeah, you can do a free trial of any of the programs,
Okay.
which is really a good way to kind of get a feel for it and just make sure it's a good fit for
Yeah.
you. So it's really fun.
That's awesome. And I know you do some in-person things for Northern Colorado, like just a couple
Yeah.
times a year, but most of your work is virtual.
Yeah.
And when people purchase a program, do they get to connect with you or ask questions or what all happens there?
Yeah, yes. I'm a big relational person. So for me, it's really important to have that connection piece. So every week when a mom is subscribed, she'll receive a check-in email with different kind of like pointers and then just kind of checking in and making sure everything's feeling well. So that's a good touch point. And then moms can always ask questions. So that's kind of what my work days look like, is responding to moms. They can either message on the individual message platform, so they can send me like a private message, or they can comment on the exercises. So on a lot of the
Okay.
exercises, you'll see there's like 5 questions, and then I'll answer all of them, and to make sure that moms are getting like the absolute best form and the most out of each exercise.
That's awesome. That's
So yeah,
awesome.
it's fun. And then
That's
moms
awesome.
can add on again a virtual consultation if they want to. Some moms do want that, 45-minute one-on-one call, and then some moms honestly don't need that, and they can just go through the classes on their own, and then we can just be an email communication beyond that.
That's awesome. And where can people find you online? Is it just Strong Core Mama on Instagram?
strongcoremama.com
Okay.
is
And
the website with the
strongcoremama.com.
freebies. Yep.
Okay.
So yeah, I have a lot of like return to run checklists to make sure you're able to run safely, and then 5 top tips for recovery, postpartum recovery. All those things are on strongcromama.com.
Okay.
And then, yeah, social media is Strong Core Mama. And yeah, I
Yeah.
love connecting with moms on there. All of the questions are good because I really, if someone has a question, it's very likely that someone else has it. And so
Yeah.
I really get to address so many questions on there. And I always joke that there's no such thing as TMI for a pelvic floor PT because we kind of just talk about it all.
Hmm.
So
Yeah.
we do. And I love it. I feel um, like it's something that we need to be talking about more. And so I feel like, again, this is a place the Lord has put me. And yeah, I feel it's such a vulnerable but important part of for all of us. And so I feel very honored to be part of Mom's journey.
That's so cool. And we need that. We need somebody that is enthusiastic and joyful and hopeful and
Hmm.
gets it
Yeah.
to, just in anything we're dealing with in life. It makes a difference when someone's walked the road you're walking, even if it looks a little bit different, but just to have that, because it is an intimate conversation,
Yeah.
or
Yeah.
things we, want to fix or we've tried to fix on our own, Googling a billion things, and there's
Yep.
so much information out there.
Yep.
So I can
Yeah. And
see.
I wanted to mention this earlier and I forgot. The thing that is tricky, and actually this was the other reason I created the virtual programs, is that there's a lot of bad information out there. And so what I kept seeing in the PT clinic was that moms were actually had signed up for, again, whatever freebie or very like low price program, and for their diastasis, but then they would actually notice that their pelvic floor symptoms increase, and it's just because the person that they're learning from really didn't have that pelvic floor anatomy and physiology. And so it just is so discouraging to me when a mom like has pure intentions of like, I'm going to fix this, but then it actually gets worse. Like that's
Mm-hmm.
so defeating. And so
Yeah.
I really wanted to create a safe program for moms, to be educated and to be empowered, because I was so sad seeing all these moms have negative experiences.
Mm-hmm.
And so that was a really big driving factor. So if moms, again, have questions on what's safe and what's not, like I'm happy to play a role in like educating and leading you in the
That's
right direction.
awesome. That's awesome. Well, thank you so much for coming to share today. I
Yeah,
really
thank
appreciate
you.
your
This is an
time, and
honor to be on here.
yeah, and hopefully we've encouraged some women to just take a step forward, even if it's like, okay, I'm going to make a goal to get a little bit of help or find
Yeah.
out more or check out the free resources, and not live in pain or
Yes.
live with these issues, you know?
Yep.
So for
Yeah. Don't
sure.
accept pain or weakness or leaking as your new normal.
That's
You don't have
awesome.
to.
That's so good. Thank you so much.
Yes. Thank you, Megan. You're wonderful.
Thanks for joining the Only Love Today podcast. I enjoyed talking with Dr. Anna about stewarding the bodies that God gave to us, especially after becoming a mom and taking care of pelvic floor issues and all other kinds of things. Her resources and website are listed down below in the description at Strong Core Mama. If you haven't already, could you take a second, share it with a friend if this episode in particular was really helpful to you? For more episodes, you can check out the Only Love Today Mom YouTube channel, or you can also listen to the podcast on Apple Podcasts or Spotify or wherever you get your podcasts. Remember, whatever God has for you today, before you respond, stop and think, only love today.